So I'm Dr. Prakash Ayadure, the lead consultant of Department of Arthroscopy and Sports Medicine at Rela Hospital, Mumbai. So this meeting is for something new that we have started in this hospital. This is one of its kind operation that is done in Tamil Nadu for the first time. This is synthetic ligament reconstruction. So this is the background of the meeting. We have done this operation on a patient who is 23-year-old. He's an IT professional, had a very bad injury 3 months back. He had a fracture in the pelvis, and then he had multiple ligament injury on the right knee joint. Initially, we stabilized this patient with pelvic surgery in the first instance by Dr. Sunil Gavaskar, who is the head of orthopedics in this hospital. And then primary repair of some of the ligaments in the knee joint, and one of the main nerve to the knee joint was done at this hospital 3 months back. We gave that injury time for that injury to recover for 3 months now, and we thought this is the right time for this operation to be done. So why did we choose this synthetic ligament? Is because the patient had multiple ligaments, which means he had more than 3 ligaments torn in the knee joint. One of the ligament was primarily repaired, the other 2 was left behind. So now the patient is very young, and the patient is also had a back injury. So if traditionally what has been done before is we take graft from the patient's own leg from some other portion, place that graft inside the patient's knee joint. Now because we have the liberty of using the synthetic graft, one procedure is less for the patient, and the patient will be able to recover early. As we're speaking, the patient is recovering, and tomorrow he'll be able to walk. So that's the gist of the operation that was done. The ligament was procured from England, Leeds, and this is Dr. Tadeusz Kosowski from Poland. He has experience with more than 2,000 knee operations using this ligament reconstruction, and that is Dr. Baha. He is the inventor of the synthetic ligament. So that is the prelude for the case. If you have any questions or if you have something.
Good afternoon, everyone. First of all, I would like to thank Dr. Prakash and the hospital management for the invitation to join and assist in the surgery. I think it was elegantly performed surgery. Difficult cases always with multiple injuries, as you've explained, and it's a challenge, this kind of case, and it gives this young man a chance to start walking tomorrow, full weight bearing, and we saved some of his native tissues, which would have to be used now to stabilize the knee. At the end of the procedure, the knee is as stable as his other knee, and I think it gives him a chance in following this proper rehabilitation, to lead more or less normal life. So I think it's an important step. I've had an experience of using this for some years, and the results are very good. And I think especially cases like this where we need to find some tissue, some graft, it is a great help. It's just on the shelf, you can use it straight away. Congratulations on your first difficult case. You have chosen a very difficult case, but it went very well, so I think the patient and the surgeon should be pleased.
I'm Bahar Sidhon. I'm an engineer, a bioengineer. My role has been in partly participating in the designing and the testing of this device, which we feel is adequate, and very pleased to see this being used in this wonderful institute. In fact, the facade looks more like half the size of Buckingham Palace. It's absolutely amazing what you have here, and so delighted that we have provided something that could help the surgeon to preserve the biological capital of the patient. Thank you.